Hi, my name is Dr. Eric Janowitz, and I am the founder and clinic director here at Synergy Oviedo Chiropractic. Now, a lot of patients ask us about this term called stenosis. There's two types of stenosis that we hear. We hear about spinal stenosis and foraminal stenosis. Let me kind of break that down for you by looking at a little bit of anatomy and trying to translate these terms to English, right? And so this is a vertebral segment. In this one, this is the low back. So this is a bone above, a bone below. Say this is L5 and say L4. Then you have a disc in between here. Now looking from the top down, this is the disc, or this is looking from the head down, sliced through. This is a full disc. You have an outer cartilage ring called the annulus, and then you have the center jelly, which is the nucleus. This is the spinal cord coming from the brain down here towards the feet. This area is the nerves that come out. In some cases in the lower back, for example, this can cause things like sciatica and cause pain down your legs. So what occurs here is spinal stenosis is a condition where this canal coming this way is narrowed. So it's a narrowing of the canal. Let me give you an example. If you look here, this vertebra segment has arthritis around it. So you can see this has arthritis. Now what occurs is that arthritis occurs in a full ring. That full ring of arthritis then can cause more bone to occur here and then make the hole smaller. So stenosis can occur by more bone growing into the canal. It can also occur by what you're seeing here, by an actual disc herniation into the area, also making the hole smaller as well. So now you have a smaller hole in the spinal canal, and you have to realize that you have vertebrae that are stacked up on top of one another. Now this is where chiropractic can be really important for you. When you have stenosis, think about this. You have a hole like this. Let me see if I get to the camera. You have a hole like this, and that hole is nice and big. You can see right here. Now what occurs is if the body is out of alignment, you have stenosis, it narrows, and the body's out of alignment. Now the hole is smaller. If that hole is smaller because of the alignment, there's even more stress. So a lot of times people have this misconception that you can't get chiropractic care when you have stenosis. And that couldn't be farther from the truth, because the reality of it is that because you have stenosis, it's even more important to make sure the alignment is good and powerful. All right, so we talked about spinal stenosis, the narrowing of the canal, and how important it is to make sure that alignment is even more in a line per se, because that hole is already smaller. So then you also have something called foraminal stenosis, IVF, or intervertebral foraminal stenosis. And what that is that's formed by the bone above, the bone below, and then it forms a hole, and that hole is where the nerve comes out. Now again, normally that hole is nice and big, as you can see here, when there's good healthy tissue and good alignment. Well, when the spine gets out of alignment over a period of time, the spine can break down. That breakdown is also called arthritis. Then that makes the hole smaller. So that hole could be smaller based upon arthritis pushing into the area. It can also be smaller because the disc can be degenerated. So you hear terms like degenerative disc disease. So it makes the hole smaller because it pushes down. So in one aspect, it goes in because of arthritis, pushing down because of the fact that there is a degenerated disc. And then the third thing that can make it smaller is if you get an actual herniation. So a lot of things can come in that space and then cause pressure to that nerve. So in our practice and in the use of chiropractic, making sure the alignment is going to be really critical, because this is a game of millimeters. I tell my patients it's a game of millimeters. So just a few millimeters out of alignment can cause a whole heck of a lot of pressure, and the difference between you dealing with chronic pain or pain that is getting better and your body healing because there's no pressure on the nerve. So if it is a misalignment, you correct the misalignment. If it is a herniated disc or a degenerated disc, we do a technology called spinal decompression therapy. Again, this is a traction-based procedure that will make the hole bigger. So it's a way to physically make the hole bigger. And then it can also cause a negative pressure in the disc to help bring it back in. Again, one other component occurring there. And then having the alignment good to make sure that there's very little of the arthritis effects into that area as well. Now, those are the most common things that we hear about in terms of spinal stenosis or IVF or foraminal stenosis as well. If you have this, you've seen this on an MRI report, or you know somebody that has that, I definitely recommend you talk to a chiropractor in your area, let them know what you have going on, bring in any sort of reports. A good chiropractor will also have an x-ray system on hand where they can take films right there as well to confirm these things. And then also look for a doctor that has technology like spinal decompression and some rehab in the office where they can combine that, which is what we do in our Synergy model. So if you're in Central Florida, check us out. Otherwise, do your homework and find a doctor that has these elements in your area. Thank you.